I was thinking about like the coronavirus. The importance of having a strong immune system is, a big deal right now. Would you say that this is something that you would use for somebody that may be traveling or that may be exposed to that environment?
Yeah, absolutely. I kind of laid out my coronavirus plan. And I said, if I was the World Health Organization, I just did a podcast on this.
Oh, really?
And Regan Archibald was anointed the president or whatever of the World Health Organization. What would I do? Everyone would get thymosin alpha-1. Everyone would get a Chinese herbal formula called yin chow, and everyone would get cordyceps. And so, then we get them all the essential nutrients.
What was the last one?
Cordyceps. It's
cordyceps. Is that what is that?
It's an adaptogenic herb. So it's a mycelium. So it's in the mushroom family.
Oh yes, okay.
But actually, it's a parasite that grows on the larvae. If you want to get really technical about it, but
probably too much information. So those would be your prescription for the enhancement of your immune system to possibly prevent infections from outsider influences here. Is that pretty much accurate?
Right. Well, if you think about the people who are most vulnerable to the coronavirus, it's people who already have weakened immune systems. It's no different than the flu, and pharmaceutical companies are working hard to create a vaccine, but right. I think we could get more intelligence by using peptides instead of dumping another vaccine in a person.
Right. Yeah, absolutely. And it would be good if their immune system's already strong, then it would be a much more effective way to go than to try to fix something when you already, you're succumbing to a condition, as opposed to doing it before that, then you never get it. I mean, there's tons of people in China that don't have the coronavirus and live in that area. And why is that? So their immune system's working. The people that I've read about that have died have been older, so their immune system's not as strong as it should be. So this would be a good route. So if you're planning on traveling or you need to improve your immune system, this would be a good recipe to follow. How would they get these type of where would they find these products?
Well, I mean, this is where you've got to find a 503B compounding pharmacy. Okay. That means the GMP's got to be in, because there's a lot of peptides that you can find them online and they're just not safe. I mean, there's bodybuilders are the original biohackers, and so they kind of brought these things to life. Yeah. And unfortunately, there's a lot of black market where these peptides are being, they're being, compounded and put together in a way that's not as effective, not as safe. So we use tailor-made compounding. I know you had Ryan Smith on your show, and Ryan and I have collaborated in a lot of different ways. I've created a doctor training for clinicians to learn peptides in an advanced track. And so Ryan's been a collaborator on that project. And so we use tailor-made compounding because not only have they grown, 8,500% in the last year as a company. I mean, it's a lot, but they have the most robust resources available. I mean, they have the literature, the science. They've got the doctor support that we've needed in my clinics for my doctors, and they produce a great product, and you'll feel it once you start taking those. So have you taken any peptides, Ross?
I have. I had my own little trial. I learned about a peptide that I have a show about. It'll be on sexual wellness. I wanted to try out the 141 and see how that worked for me.
The PT 141? Nice.
Yeah, you got it. Yeah. So when I was talking to Ryan, he was like, this product has 3 big benefits. And he said, it'll help you with your tan. It'll make you, you can help you lose some weight. And you'll be very, you'll be sexual. It'll enhance your sexuality. And I was like, well, that sounds like turning me into a 20-year-old. I think that's all. I thought that was a great deal. Sold. I'm like, yeah, I know, sold. That's an easy sell. So, there'll be an episode on that one specifically, because people know about how to do that. But I just love that one. So that was the one I've tried. I've got some of the other ones, the 157. And, because, there's some that are just kind of an overall one that can help you overall, and then ones that are more specific for condition specific. So, overall are probably, the first ones I would want to go over. The challenge is making, keep using the ones with the minimal side effects, right? Exactly. Like 141 has some digestive issues that you have to overcome. So, yeah. Yep.
Sorry for the interruption again. To find out more about this speaker, become a speaker on our show, have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card and dominate your area, we're here to help you. Just text your name and any question to 561-962-1231. Write that down. That's 561-962-1231. Or go to our website at drrosscarter.com to learn more. On with the show.
So tell us about the ones that you are using primarily in your practices to help different conditions. What are the main conditions that people are looking for solutions to that you're working with?
So there's kind of 5 core areas that we focus our peptides on to simplify it. So we look at anti-aging, longevity. And so in that first bucket, that can be peptides like CJC1295, epimorelin. And these are both, they work on the ghrelin receptors and the growth hormone receptors on your pituitary. So essentially they're creating more receptivity on your pituitary so you get better secretions of growth hormone.
Right.
And I can tell you, I mean, when I started using those, I put on about 8 pounds of muscle in less than 2 months. And so,
really?
And when you get off them, it's not like they stop. And I'm not a bodybuilder. I'm a small frame runner type of dude. But I was like, I want to start getting a little more bulk. And my kids, I got teenage boys, and so I need to keep up with them on the snowboard and on the skateboard and fitness wise and on the basketball court. And so I'm crushing it now. I mean, it's been really fun to see what those peptides can do, and those very safe too. There's another one called tesamorelin.
Yes.
And tesamorelin is, it's an FDA-approved drug. You can use it in HIV patients who've had, basically dystrophy. Their muscles are atrophying, and so the interesting thing about that one is it increases the IGF-1 factor, which is directly correlated to your growth hormone, by 181 points in the clinical trials. And so,
right. So this could be used for sarcopenia.
Belly fat. What's that?
This could be used for sarcopenia, right?
Sarcopenia, exactly, yeah, which is a huge cause for an anti-aging peptide there. Yeah. But it's also great for belly fat. Patients just feel strong on it. This is the one I get all my friends on. I'm like, if you want a real big boost, and the FDA may not let tailor-made compounding utilize this after March. There's certain peptides that work really well, and the pharmaceutical company seems to snatch those up. So just FYI, get it fast while we can.
Order a bunch now.
Yeah. Yeah. So those are some of the, the anti-aging ones are fun because they work on the growth hormone pathway. There's another one called epitalin, and epitalin, it increases your telomere length. And, we've seen as much as we'll do an infusion of like stem vive, some perinatal tissue, and then we'll use the epitalin, and we'll see about a 10 to 15 year decrease on somebody's biological age through telomere testing. So
wow.
Yeah, so it's super powerful. And I'm not 100% sold that telomeres are everything when it comes to aging. There's other markers that we want to look at, but that one's a fun one.
Actually.
Yeah, exactly. So there, but yeah, those are some of the main peptides we're using for anti-aging, and they're super fun. I also like IGF-1. Just using that as a peptide. You sleep like a boss. You wake up, you just feel strong. And the IGF-1 is a fat-burning hormone. You'll find it in your muscles. Uh-huh. And the best thing I notice about that is I when I wake up in the morning when I use IGF-1, I feel like I'm a kid when I wake up. You remember how it is when you're, like a teenager or like, 10, 12.
That was just, wake up just a few years ago.
Right. I mean, just yesterday for us.
It's just yesterday that happened. Yeah, I remember. So you just feel like ready to take on the world and with lots of energy, basically, right?
Yeah, and IGF-1, I use it as a nootropic as well. So it actually influences your brain performance. And it just keeps you very focused, very alert, and you can learn so fast. I mean, rapid, accelerated learning. And so that's another fun one.
I love that. I love that. Yeah. We'll have to. So can you use multiple peptides at the same time without a problem? Or are there contraindications for it?
There's certain peptides that you want to cycle on, cycle off. And so if you're working on, like the growth hormone pathways and you're really trying to influence that, you want to, get on it for a cycle of a couple of weeks. And then usually we'll say take 6 weeks to 8 weeks off. And if somebody's a professional athlete, a lot of these will show up in the doping. The anti-doping laws prohibit this. So I should put that caveat out there, like don't go crazy on these until you know the rules if you're a competitive athlete. But then you may want to cycle onto something like the MOTA-C or the MOT-CS, or MOTSC. This is a great one for mitochondrial health, and this will kind of clean up those ATP and AMPK pathways, sirtuin inhibiting pathways, so that you clean up a little bit more of that cellular pathway instead of constantly being pro-growth. So there's ways you can influence it, but you can use these together because, if I look at it in the 5, we have our anti-aging, and then we have joint repair. And so joint repair is one like the BPC-157. You can almost use it safely with a variety of the peptides. So we'll typically use that with, we use the BPC-157. One of the things that does, speaking of growth hormone, is it stimulates the growth hormone receptors right inside of the tendons and the ligaments. So it's a really powerful way of influencing, especially if you're doing in a regenerative medicine, stem cell therapy into the joint. The BPC-157 is amazing to inject it directly into that joint space or around the joint. You can also swallow it orally. You'll still get benefits that way. But if we're doing the injections of the BPC with the stem cells, then we'll also do some type of like CJC epimorelin as a combo or as a stack.
And what is that for?
And that's just more for repair and recovery. That's more for the growth hormone releasing hormone and the growth hormone releasing peptide that works on the ghrelin and on the growth hormone parts of the pituitary. So
these are peptides mainly for regeneration and recovery.